Good Tuesday afternoon. I'm Dr. Martha Buchanan, Public Health Officer and Senior Director here at the Knox County Health Department. Our moment of gratitude today is dedicated to families who are wrapping up the summer break and entering a new school year. We know the school year will look different, and our thoughts are with the parents within our organization and our community who are making the best decisions for their families. As tough as they may be, we wish you and your kids a great and safe start to the school year. Our schools have created thoughtful plans, but it's up to students, teachers, and parents to ensure that the 5 core actions are being followed everywhere, even outside the school and even in the home. That means social gatherings, watching sporting events, and anything else you might do. And that includes older students and younger students. It doesn't matter your age. By also following the 5 core actions everywhere outside the school, it will reduce the likelihood of bringing the virus into the school or back to your home. Today's real-world example of putting the 5 core actions into play is getting gas and going into a convenience store, something all of us do regularly. While fueling, if you have disinfectant wipes, use them on the handles and buttons before you touch them. After fueling, use a hand sanitizer that's at least 60% alcohol, or go into the convenience store and wash your hands for at least 20 seconds. Washing your hands is really key after this activity. If you go into the convenience store to use the restroom or maybe to pay for your gas or buy some food, wear your mask the entire time. If you have to wait in line, keep at least 6 feet between you and the person in front of you or in back of you, but also wear your mask. These are just a few simple things that you can do to keep yourself and the folks around you safe and healthy while still going about your day. This week, we are continuing to test at the Jacob Building from 9 to 3 on Wednesday and Friday. We are no longer collecting insurance, so we anticipate the lines to move more quickly. Next week, due to a prior reservation at the Jacob Building, we are altering our testing schedule. Next week, we will test on Wednesday, Thursday, and Friday from 9 a.m. to 1 p.m. at the Knox County Halls Senior Center on Crippen Road. We'll move back to the Jacob Building the following week. Sorry about that. As a reminder, the Board of Health will meet tomorrow via Zoom at 5 p.m. The public may watch the meeting live on Knox County's YouTube channel, the Knox County website, or on community television. The benchmarks will be updated tomorrow prior to the Board of Health meeting and will be reviewed by the board Wednesday evening. We will also review them Thursday during our media briefing. Now we'll move on to the local situation. We have 54 confirmed new cases since yesterday's report, giving us a total of 5,483 confirmed cases of COVID-19 in Knox County since March. Additionally, we have 203 probable cases. 3,384 of our cases have recovered, giving us 2,251 active cases. 236 individuals have been hospitalized at some point in their illness. 38 Knox County residents are currently hospitalized. We are saddened to report an additional death today related to COVID-19, bringing our total to 51. And again, our hearts go out to those folks who've lost loved ones or family members to COVID-19 during this pandemic. Now I'll open it up for questions.
All right, as a reminder, you can type your questions into the chat feature and please include your name and the media outlets which you're affiliated with. From Paul with WBIR, how is Knox County tracking teacher/student exposures? We know the schools have their own contact tracing team. Do they report to the Knox County Health Department?
So it's a project we're doing together with Knox County schools. Teachers, students, staff, they'll all be counted with their numbers the way they all are. The schools are helping us with the internal contact tracing. We're actually doing those initial interviews of the cases to get the information that's needed. We'll be doing the outside school contact tracing. They'll be doing the inside school contact tracing. And then all the information will be shared with us for reporting purposes. And they'll be tracked just like everybody else in our community.
Paul's additional question is, will the health department keep a separate list of Knox County school cases or exposures?
Nope, they'll be in with everybody else's.
From Laura with WATE, Knox County Schools emailed teachers about a 24-day quarantine period if a loved one contracts COVID-19, 10 days for the loved one plus 14 days to make sure they're not sick. Did KCHD help write this quarantine/isolation policy for KCS or review the measure?
Actually, that is guidance from the CDC and the State Department of Health, which is not unique to Knox County Schools. It's true for anyone who has a case of COVID-19 in their house. So if somebody has a case of COVID-19 in their house, that person will need to stay in quarantine, or actually, let me start over. The case stays in isolation for at least 10 days after their symptoms onset, plus 24 hours of feeling better. So that might be longer than 10 days, but it's never going to be shorter than 10 days. So that's from symptom onset. The person who lives in the home with them, if they can't leave the home, their 14-day quarantine starts when the case is out of isolation. So that could be up to 24 days. There are a lot of variables there. If you think about it, so the case may not get tested until after they've been sick for a little while. So they might be well into their isolation before we even know about them. If the person who lives in the home, if you have the capability for that person to be in a separate bedroom with a separate bathroom and really not have any exposure to the case, then their quarantine can start then. Or if you have the capability of the person being able to go stay in a hotel for a little while, or the case staying in a hotel for a little while. The point is, it's that last contact. Whenever that last contact happened with that case, that's when the quarantine starts. And that's true for everybody. That's not true for just Knox County Schools. That's true for me. It's true for all of our staff and anyone else who gets COVID. Your day of quarantine, day one, starts the first day after you've had contact with that person. So, if it's a child and say the parent is a teacher, they're likely going to have contact with that kid the whole time they're not feeling well. So that could be a 24-day quarantine period. And we know it's going to be challenging. It's challenging for all employers. It's challenging for us. We're talking about how can we allow folks to work from home if that were to happen? How can we be as creative as we can be? We encourage employers to do the same. Obviously, teachers have very limited things they can do at home, but I know the schools will be creative. They have been through this whole time, but they'll continue to do that.
Her follow-up question was, can you explain the importance of the 24 days?
Sure. The importance of quarantine for everybody is to stop the transmission of disease. So if somebody's been exposed to COVID-19 is highly contagious. It's very likely that they're going to get the disease. So we take them out of the general circulation so they're not exposing others before they even know they're sick. Incubation period of COVID-19 is 14 days. So we want to keep them out of the general population for 14 days. One really important thing to remember is you can't test yourself out of quarantine. Doesn't matter who you are or how important someone feels you are to the team or whatever. You can't test out of quarantine. It's at least 14 days, if potentially not longer, based on the situation.
From David with WVLT, what time will the benchmarks be updated on Wednesday?
That'll be afternoon.
From Laura with WATE, can you give details on today's new death and those over the weekend?
Today was a 74-year-old female, and yesterday was a 66-year-old female.
From Vincent with the Sentinel, has KCHD been made aware of a case cluster at UT that originated at a student party?
Well, as you know, we don't comment on clusters. We have clusters throughout the community, and we don't comment on them.
From Laura with WATE, will the Board of Health / KCHD be reevaluating the mask mandate at tomorrow's meeting? Can we see this mandate working?
I believe that, I don't think we can say it's just the mask mandate that's changed our numbers, but our trajectory for going up has really leveled off quite a bit. So we're happy. What that speaks to is that our community is really getting behind the 5 core actions. Masks are part of that, and a very important part of that. But I think our community is really getting behind the 5 core actions, and our case counts have been lower, and we're really thrilled. We hope it stays that way. What's really important for everybody who can hear me to remember is this is not the time to go, woo, we did a good job, we're done, because those cases are just going straight back up. So everybody students, teachers, parents, everybody, regardless of your age, regardless of what you do, you need to practice the 5 core actions all the time, at home, at work, out in the grocery store, at the convenience store, in school, everywhere you are. That's going to keep you and our community healthier.
And her first question was will the Board of Health be reevaluating the mask
Oh, I'm
mandate?
sorry, forgot about that.
Right.
I'm trying to remember what we decided last week about that. I think what they decided last week was that I would bring any significant updates to them if there were something that they needed to be aware of. There really haven't been any problems. Our complaints have decreased, and so we continue to distribute masks. So at this point, there are no major problems. I don't anticipate bringing that to them. They may have questions for me regarding the mandate.
From Paul with WBIR, it's a possibility that the governor will deem teachers/school staff essential personnel, meaning exposures and asymptomatic positive employees will have to report to work. Do you think if this happens, it will jeopardize any gains we have made as a community in lowering cases?
So for an essential worker to return to work, they have to follow guidelines. So they have to wear a mask the whole time. We know that masks reduce the risk of exposure, and it's only for asymptomatic essential workers. The moment they have symptoms, they go home. So it's a method that's been used in other industries without causing further outbreaks. So we think it's an effective measure.
From Vincent with the Sentinel, prior to the pandemic, Knox County had a 15% poverty rate. Knoxville proper had 26% poverty in 2019. Is it reasonable to expect this population to have an extra bedroom and bathroom for quarantine?
It's not, and we know that's really unfortunate. There are a lot of people who don't have an extra bathroom and bedroom for quarantine. So for those folks, it will end up being a potentially 24-day period. And we acknowledge the hardship on everyone in doing that. We have people in our employee who that will be very difficult if that happens for them. So we encourage employers to be creative and try to work with them on that and see how they can best work around that.
From Bob with the Knoxville Liberty Press, has the health department found clusters of cases coming from more than 25 people within a 900 square foot area?
We don't comment on the details of clusters, and so I don't have that level of detail about clusters, and we don't discuss details of clusters.
Also from Bob with the Knoxville Liberty Press, how does the Board of Health new social distancing guidelines/regulations impact an upcoming public fashion show this weekend?
I believe the board did not pass the regulation last week. So there is no new regulation. It's still 50 people based on the Tennessee Pledge.
Also from Bob with Liberty Press, are teachers at a higher risk than other workforces within our community? Examples of grocery store, department store, healthcare, and other profession settings? Well,
I think we're all at risk for COVID. No matter where we work, no matter where we play, we're all at risk of COVID. COVID doesn't just go to workplaces. COVID is all throughout our community. So that's why we talk about the need to practice the 5 core actions no matter where you are. Close contact workplaces where everybody has to wear a mask. They're doing that and it's working. In the schools, there's a plan. Teachers need to be in masks, staff need to be in masks, children that can need to be in a mask, and practice social distancing. Those things work to reduce risk no matter what your job is, no matter where you work.
From Vincent with the Sentinel, you've talked previously about how hard KCHD employees are already working on contact tracing. Does KCHD have enough people to perform contact tracing when schools open?
Well, so we've done several things to help with that. It's going to be challenging. I'm not going to pretend like it's going to be all smooth and easy. It's going to be challenging. So we have a couple things in place. One, Knox County Schools set up their own contact tracing team, as has UT. So UT has, they both have contact tracing teams that they're going to have in place. In addition to that, you've heard us talk about bringing on other staff that aren't internal staff to Knox County. So we are bringing on staff through staffing agencies to do contact tracing and help us with that. So we're continuing to staff that up. I don't have that number in front of me, but frequently we do actually have that number. We'll have it on Thursday. So we do talk about that. And then in addition to that, we've moved our contact tracing and contact monitoring and case monitoring. Tennessee Department of Health is doing that, which takes a pretty nice workload off of our staff. That's being done by the Tennessee Department of Health staff they've hired extra staff to be able to do that for us.
From Paul with WBIR, I've not asked my marathon question in a while. If this were a marathon, what mile are we on?
You haven't, that's true, sorry. Wow, we honestly, we still haven't hit the halfway point. It's just the truth. We still are kind of climbing up that hill. We've slowed down. That's great, but we're not seeing our cases go down. We had that one little dip. It was kind of a false flat. If you're familiar with cycling terms, where it seems like you're going down, but really end up having to climb some more. So that's where we are. We're still climbing. We keep continuing to see that. We want to see that continue and for that case rate to drop. But that's going to be contingent on all of us doing our part to reduce risk throughout our community.
From Bob with the Liberty Press, there are studies about certain masks, bandanas, and scarves actually making the transmission worse than not wearing a mask. Does the Board of Health have any talk of regulating what specific masks must be worn in the future?
That's a decision for the Board of Health. I've seen some data from the CDC where people were questioning all the different kinds of masks. Basically the CDC said, there are some preferences, but some face covering is better than no face covering. So that reduces risk to those around you.
All right, any other questions? Please go ahead and submit them into the chat feature now. From Brian Hornback, anything we can do to help the lack of information, like Commissioner Bustler?
I think the way to combat the lack of information or misinformation that's out there is pointing people to reliable sources like our website, Tennessee Department of Health's website, the CDC's website, or the World Health Organization's website. All of those websites have great information. I really like the World Health Organization's Mythbuster section. It's got some really commonly asked questions and really good explanations for why those things may or may not be true. So pointing people to reliable sources is the best way to bust misinformation, regardless of the topic.
All right, I see Vincent says 1 second, so he's typing. In the meantime, if anyone else has any questions, please go ahead and submit them now. All right, Vincent says, never mind. So we'll do one more last call just to make sure we're getting all the questions in. From Bob with the Liberty Press, how much of the $7 million has been spent by the Knox County Board, KCBH? So I'm assuming that means Knox County Board of Health.
Well, the Knox County Board of Health doesn't have a budget. They didn't get $7.1 million for COVID response. The Knox County Health Department got $7.1 million for COVID response. And part of that will go to pay those staffing agencies we've talked about. And other things that we're doing. So that hasn't been spent yet because actually I'm not even sure we have it in hand yet. The contracting process is a process and takes time.
All right, and he clarified and he said he did mean Knox County Health Department. All right, not seeing any other questions in here. So if there are no further questions, we'll go ahead and log off. And once again, we will see you on Thursday for our next media briefing. Have a good rest of your day.